Welcome to aminacademy.com. In science and technology, let us discuss about human organ transplantation. What is organ donation and transplantation? Organ donation and transplantation is a surgical process that replaces a failing organ with a healthy one from somebody else who does not need it. It involves two back to back surgeries, one for the donor and one for the recipient. An organ donor is usually somebody who recently died and volunteered to donate their organs while they are alive, but not always. Living donors can also donate certain organs but and tissues during their lifetimes. Organ transplantation offers a second chance at life to people who have life threatening diseases or injuries to their vital organs. But the need for organ donations far exceeds the available supply. For example, in the US, over 100,000 people are waiting for a life saving organs transplant on any given day, but only about 40,000 organs transplants take place in any given year. That much difference. Now, let us discuss further about human organ transplantation. Organ transplantation is a surgical procedure where the damaged or failing organs is replaced with a healthy one from a donor, either living or deceased. It's life-saving treatment for end-stage organ failure and can improve quality of life. Common organ transplanted includes the heart, kidneys, liver, lungs, and pancreas. Here, more detailed look at organ transplantation. Why is it needed? When an organ fails due to disease or injury, it may no longer be able to function properly. Organ transplantation can be a life-saving option for those with end-stage organ failure. Types of transplants. Transplants can involve a living donor like a family member or a friend or a deceased donor. The type transplants living versus deceased donor depends on factors like availability of suitable donors and the recipient medical conditions. Commonly transplanted organs, kidneys. The most commonly transplanted organ is a kidneys. Liver. A transplant may be needed when the liver is severely damaged or unable to function. This is a donor, this is a recipient. Liver transplantation involves replacing a diseased or failing liver with a healthy one from a deceased or living donor. It's life-saving procedure for individuals with end-stage liver diseases or acute liver failure. Although donor organs availability is a major limitation. Next one, heart. The heart transplant is an option for people with severe heart failure. Heart transplantation, also known as cardiac transplantation, involves replacing a failing heart with a healthy one from a donor. It's treatment option for individuals with end-stage heart failure who have not responded well to other treatments like medications or devices. The procedures involves removing the damaged heart and replacing it with a donor heart which is then connected to the recipient blood vessels. Lungs. Lung transplants can be necessary for people with severe lung diseases like cystic fibrosis or emphysema. Lung transplantation is a surgical procedure where the diseased or damaged lung is replaced with a healthy lung from a donor, typical a deceased donor. It's usually considered for individuals with end-stage lung diseases when other treatments are not effective. These procedures can significantly improve quality of life and extended lifespan. Next, pancreas. A pancreas transplants can be offered to people with severe diabetes. Pancreas. A transplantation involves surgical replacing a damaged or diseased pancreas with a healthy one from the donor. A typical to treat type 1 diabetes. It is often done simultaneously with a kidney transplant for those with kidney failure due to diabetes. The transplanted pancreas is connected to blood vessels and the small intestines, and the recipient's original pancreas is usually left in place to produce digestive enzymes. The processes. What are the process of transplantation? Evaluation. A potential recipient undergoes a thorough evaluation to determine if they are suitable for transplant and to assess their overall health. Donor identification. The compatible donor, living or deceased, needs to be found. Surgical procedure. The deceased organ is removed and the donor organ is surgically implanted. Organ transplantation surgery involves a complex process of removing a healthy organ from a donor and placing it in a recipient who needs it. It typically involves two surgeries, one for the donor and one for the recipient. The procedure includes carefully connected the new organ's blood vessels and potentially other structures like bile ducts to the recipient's body. After surgery, the recipient is monitored in an intensive care unit to prevent complications like rejections or infections. Post-transplant care. The recipient will need ongoing medical care, including medications to prevent rejections of the new organs. What are the challenges and considerations? Organ shortages. There is a significant shortage of available organs for transplant, which can lead to long waiting lists. Rejections. The recipient's body may reject the transplanted organs, requiring immunosuppressant medications to suppress the immune system. Long-term care. The transplant recipients need long-term monitoring and follow-up care to ensure the transplanted organs continues to function properly. So far, we discussed about human organ transplantation. We have done. Please subscribe our YouTube channel.